Okay, folks, so we're going to be beginning in about a minute or so. So we're just going to allow some participants. We're going to also be live streaming via the delegation's Facebook page. So if you are able to, share that from your pages, that'd be great as well. We just want to make sure everyone is muted unless they're speaking. All right, it's 5 o'clock on the dot. So I just want to welcome everyone to the Baltimore City Delegations. I guess this is a bit of history, our first virtual town hall. We'll be covering a lot of ground in the next 90 minutes, but I want to first begin by thanking the members of the delegation for their help and assistance in pulling this town hall together, and also to all of the presenters across local and state government who will be providing updates on a host of issues that are critically important to our residents, from healthcare issues and issues related to COVID-19 response, as well as issues around unemployment insurance and education delivery, what the future of that looks like. And then also, in a very near term, how are we able to best participate in the pending elections before us for June 2nd. So we know people will continue to join through the next 90 minutes, but we want to honor and respect the time of all the participants that are here with us today. So without further ado, I'd like to dive right in. I know that as a Baltimore City parent with kids, in school, there is a lot of concern around what the landscape looks like, both in the short term for the remainder of the 2019-2020 school year, and what could be the direction or path forward for summer programming into the fall. So we are very fortunate to have with us today the CEO of Baltimore City Public Schools, Dr. Sonja Santelises, who will kind of orally share with us where we are, where we hope to be, and in light of the uncertainties, what planning for the provision of our children's education looks like in the near and long term. So without further ado, I want to give you, Dr. Santelises, the floor.
Thank you so much, Delegate Smith. And it's great to be here and be part of really these great efforts to keep the community, keep the delegation informed. I do want to start out by thanking Delegate Smith and the entire Baltimore City delegation for their interest and support during this COVID-19 crisis in really helping to make sure, that we, we in city schools are, well equipped to take care of our young people in our schools. Do want to just give a heads up that there are a couple of folks who I don't think are muted. So it's, I do it all the time, but just as another reminder, more than happy, I believe, Delegate Smith, I'll take your lead on any questions that you'd like me to take. But again, just a real note of thanks for the support and very on the ground, timely support from the Baltimore City delegation. So really, as everybody knows now, where we are is schools have been officially closed with regard to the physical building since March 13th. And following the decision of State Superintendent Karen Salmon, all city schools buildings will remain closed for the balance of the current school year. It is important to know that distance learning will continue for all city school students until the last day of school, and all families are encouraged really to ensure that their students are participating to the greatest extent possible. It is still an incentive for young people to be able to increase their grades, even though we are also keeping in mind within our grading system not wanting to negatively impact any student or family who clearly through this challenging time might find connecting challenging. We are still making paper packets available for all families, but at the same time, through a number of efforts through the city and through community and nonprofit organizations, are really continuing still to move in, getting as many of our families devices as is possible. And we're going to continue with that effort, as well as really expanding the access to internet for all families in city schools. The other piece that is important to know, in case you all are getting questions, or you yourself might have questions, we currently, the Baltimore City Board of Commissioners voted this past last week, to apply for a waiver from the state board that has given State Superintendent Dr. Karen Salmon the oversight to approve waivers for the school year up to 5 days. Our board approved a waiver for that, ability to end the school year 5 days early. So that would make, if that is approved, that would make the last day for students and families June 15th. And we are working with the Baltimore Teachers Union around ways to deploy the remaining days for teachers in some more creative ways around professional learning and extended learning time possibilities for the fall. But stay tuned to that, because again, we are in those conversations now with the Baltimore Teachers Union. The other piece is all city schools personnel whose duties do not require work on site will continue to work from home. This is particularly in light of Mayor Young's announcement last week about the shelter in place still being in effect for Baltimore City. Any staff members whose duties require them to be on site, such as our meal site workers or volunteers, they will continue to observe social distancing procedures, including the use of appropriate PPE. But we are currently now scheduling the opportunities for families and staff to pick up their belongings, to retrieve items from their buildings. School leaders are communicating those plans and schedules, and so folks will be able to do that. Right now, we are currently planning for virtual graduation by school for our seniors during the period from June 10th through June 17th. In the meantime, we will be celebrating their success through virtual events like Citywide Senior Spirit Week, which is occurring every day this week. I myself will be venturing out into the creation of my very first TikTok video as part of the celebration of our seniors. The first 2 days, we really have had great participation across the district. You can get a flyer. We have flyers posted on our website for each day this week, what each day is. So we have Hero Wednesday coming up tomorrow, Throwback TikTok, and then Decision Day, which will be a virtual decision day on May 22nd. But we invite all of you to participate, and I know some folks have already. So thank you for those who have. We also have a senior year, end of year timeline. We prioritized, as many of you know, very early, making sure that our seniors and juniors receive the first priority for laptops, for Chromebooks, because we wanted to make sure we were supporting seniors through to graduation. So again, you will see a senior year, end of year timeline that has to do with everything from grades to, promotion status, grade validation. So there's a number of pieces going on, and we do have a timeline for that for any of you that might have questions. Moving forward, we are working very closely with City Hall, with Dr. DeRaza, as well as a number of, health professionals and epidemiologists and those who specialize in public health as well. And like I said, Dr. DeRaza has been a continual support, and we are also tapping into both national and frankly international partners in helping us to plan for the return of school this fall, as well as summer programming. We will be announcing in the next week or so the summer programming options. Right now, it looks as if our summer programming will be almost all virtual. If there is a possibility for some in-person social distancing kind of activity, we will build that in. But in the, for lack of a better term, in worst case scenario, our team is planning for a virtual summer programming, and we will be prioritizing groups of students who frankly have kind of the most pressing needs, and we're working on that now. So everything from seniors who need to recover credit so that they can be part of both summer and December graduation will clearly be a priority. Another example will be rising 8th graders who will be freshmen in high school this coming year, because we know both from experience as well as our data, national research, frankly, that 9th grade year is pivotal when it comes to high school and post-secondary success. A number of our students with disabilities who were unable to receive certain supports that they are frankly required to have and have a right to will also be prioritized, clearly taking into account the physical health of both staff and students. And then some of our youngest learners, our little people, who we know that those early years that are really based in, frankly, play and group interactions, those kind of critical years, early literacy skills. So those are some of the groups we'll be prioritizing, but based on feedback from families, we are also going to be really focusing on a heavy lift with, getting things online that continue to support families' capacity to really help guide their children's learning in ways that, frankly, we didn't have to do as deeply pre-COVID, but I think in a lot of ways will end up being a silver lining that comes out of a really kind of horrible circumstance that none of us wanted. But it really has pressed the need to provide families with additional support. So I'm looking at the time. I see that it's 5:12. I want to, if it's all right, Delegate Smith, and that makes sense, I will take questions.
Yeah, that sounds great. Actually, one of the first questions I saw is from Delegate Melissa Wells, and it is related to the ongoing concerns around the digital divide and digital access issues. And she wants to know to what extent we at the city level are working with with the State Board of Education on what the guidance or the direction for distance learning looks like moving forward.
No, it's a great it's a great question. So we are working with MSDE. Actually, Dr. Salmon has actually given great breadth, a lot of room for each jurisdiction to carve out plans that best meet their needs. The other piece that is encouraging, and again, it's not fully public or firmed up, so I don't want to promise anything, but Dr. Salmon has really encouraged us to map out our technology plans in such a way that we can identify where our local resources stop. And then that way, the governor has said both food and technology is a priority for some of the federal funding that will be coming to the state. And so we are hopeful, even though nothing is confirmed yet, we're hopeful that technology and internet access will be one of those areas. As I'm sure many of, if not everyone knows by now, the mayor and the city council really came through unexpectedly on our part with an additional $3 million. We have purchased already. As soon as we got informal word that was coming, we immediately set out for a purchase of additional devices for students. And then want to emphasize also what I'm sure many of you know with regards to the internet access to Wi-Fi. And so Tina High-Hubbard on our team has just been doing yeoman's work, really advocating, negotiating. And so a part of that city funding, that additional city funding will go towards our web networking that we're hoping will be something that will help to expand Wi-Fi, but then also hopefully, I got some good news today with something that hopefully we'll announce that would really seriously give a nice boost to anywhere from 10 to 15,000 city schools families that have had no internet access this entire time. So we are really tracking. I can't say enough, and I'm not just saying it to say it, but the delegation has just been on top of this in terms of really keeping ears out and making connections for us. So I will say one of the biggest areas we're reaching now, we're getting ready to go into the second round of distribution, but we know, and we're not naive, we know that not every family that needs technology completed one of those surveys. So we are now relying on more informal networks to, excuse me, identify those families who, for a variety of reasons, we did not pick up in that initial survey. I'm also pleased to say that we did some initial analysis of round 2 of devices, and there will be a significant portion of families who have 2, 3, 4 children in the same household sharing that initial 1 device, that we will be in round 2 able to provide additional devices. And I've said this before, Delegate Smith has heard me say this as a mother of 3. I know how quickly 1 device becomes World War III in a house, and in a household. So we are pleased that we'll be able to bring some additional relief to families with multiple children in the second round. So sorry, that was long-winded, but we are doing a heavy lift in technology.
No, that was really important information. Delegate Keith Haynes has a question that I think is probably front and center as people think about us returning at some point, because our students do rely upon public transportation to get to school, very different from our surrounding jurisdictions. How can we, what are the safeguards that we need to take with MTA to ensure that they are safe? I mean, we worry about their safety in a general sense, but now we have another additional concern.
No, and I completely agree, Delegate Haynes. And it's one of those areas that we are flagging for collaboration with the city. We do know that the city has been taking extra precautions in terms of the cleaning, sanitizing of city transportation. So we will continue to work with them on that. I will be honest, we don't have a kind of finalized mapping out yet of what that will look like. We right now, even with our city schools buses, we had even pre-COVID-19, we're trying to set aside funds to, over a number of years, bring more of our own buses on, for city schools. For a long time we didn't, and just long term we saw the need to do that. For our buses, we already have a cleaning, sanitizing protocol in place. I will flag for you, though, the reality that we're facing not only in the city, but that I've heard from a number of my colleagues across the state, and that is with social distancing on buses. As I'm sure you all can imagine, the capacity of each bus plummets drastically when you're talking about making sure that there's 6 feet between every student. And I was talking to a public health, advisor a couple of last week actually, who said, no, Sonja, that when I said, really, is that 6 feet real? Is there something we can do? And he's like, no, it's real. So that means that even on our longer buses, we'd be talking about only 8 students that could fit on a bus that would normally carry 30. And so, or 30 or more. So we're going to have, transportation is absolutely a huge issue, but I won't even act as if we've got that figured out yet, but we are working on it.
Yeah, that makes sense. We have another question from the public. Someone is asking about the plan, at least for the school, in terms of addressing food security and for the learners during the summer. I know that there has always been some type of summer meal distribution, and do you imagine it looking different than it has in the past?
Yes, and it's a great question, and Delegate Smith, sorry about that. Delegate Smith has been really keeping close tabs on this issue, I think, throughout the crisis. So what I will say very forthrightly to everyone is that where we are right now is trying to assess, looking to assess what the shortfall will be between what our normal budgeted allotment is for school meals, the revenue that we depend on generating that will not be there this year. We already know that. And what impact that might have on summer feeding. So I want to be kind of really clear and forthright about the fact that, the optimal intent would be to continue with our summer feeding program with no changes at all to how we have done it in the past. So our intent is not to change up. As we, though, take stock of the impact, and I will give you an example that we have estimates now that because we were during this pandemic, I think we've been, on top days been feeding, close to 15,000 meals per day. And while that is wonderful, it falls woefully short of the 100,000 meals per day that we would serve on a normal school day or week, anywhere between 90 and 100,000 meals. And what that translates into is lost revenue for our school nutrition program. And every year we make up, $5 to $6 million from our general funds because we feel as if, of course, it's important to make sure that our students get fed. We are now looking at a deficit that could be as much as, anywhere from $24 to $28 million. And so, when I say that we're trying to adjust, it's not because I don't want to feed children, but it is because we're going to have to, just for fiscal responsibility, be able to see what configuration of feeding will allow us not to continue to run a hole that is too big to fill. So our intent is there, but I can't give you total specifics because we're still doing analysis.
Absolutely understood. Delegate Keith Haynes has a follow-up to the prior question related to transportation. He wants to know, are any of the federal funds that the schools have been, able to secure, can any of those be used in any way to address transportation concerns?
So the good news on that is, for right now, we have, Delegate Haynes, actually some flexibility with CARES money that we would not normally have with Title I dollars. The challenging news is that while we are incredibly grateful for the money that we have, it is only a fraction of what we need. And so in prioritizing both food as well as devices, there's very little left to do much of anything else. So I think part of what our work with the city is doing is hopefully saying, is there a creative way to use FEMA dollars and other things to help buttress that? But that's why we're all hoping for another federal stimulus package. I know that it's looking wobbly now, given the Republican response from Senator McConnell, but I also know that our own senators, Ben Cardin, Senator Cardin, and Senator Van Hollen have just been, soldiering to really try to push through packages that will directly impact, Baltimore City and city schools. And for that, I can't ask for anything more. So we're really, I will just tell you that it's going to be hard because I know the city also has limited dollars, but we do. The good news is we do have some flexibility.
Very good. I'm trying to see if I've missed any questions so far. I know that we only have a few more minutes with you. I know that this is going to be a very unconventional senior year for our seniors. What are the types of things you are able to hear from students to the extent you're hearing from them? I think it would be helpful for us to know how we can support them. Once this is kind of moving forward in a few weeks, they'll be, or a few months, they'll be graduates.
Well, and it's a timely question because I actually had a conversation with a couple of seniors today from the CEO Youth Advisory Group. And one of the major themes was the connections. They were very clear that communication was big for them. And so this idea of reaching out for them is not small. Like, they talked about the fact that they had school psychologists who were calling to check in on them, or teachers who would call and check in on them. And I think similarly with graduation, one of the things that, and one of the promises that I made early on, which I might have neglected to say earlier, is that even with this virtual celebrations that we're planning, a real commitment and promise that I made that as soon as we have a pocket of time where we can gather, even if it's in smaller numbers, that we're committed to an in-person graduation for them, which, is not their first choice because we'd all like it to happen now, but we are looking to dates later in the summer that we might be able to bring students back, or later in the year as we gauge whether there'll be surges or other things. So we have made the commitment to them that they won't totally lose out on that year. But I would say whether it's some of the lawn signs that we're getting printed, whether it's, on social media, getting on Facebook, or they don't do Facebook anymore, but Instagram or a TikTok video, but that kind of thing matters a lot to them.
I think we might have one last question before. I think it's a question largely from the public around kind of how can we ensure that every young person who is in need of food does receive it. And I think I just want to add a little texture here to what the CEO has shared, is that schools are a facet of kind of the food response that's happening in the city right now. They are not the totality of it. So they are working in league with the Park and Recs. We're working with community partners. They are an important partner, an essential partner in the food response for young people, but they are not the only place that they're able to receive meals. The city has, between the constellation of efforts with the schools and so forth, over 2 million meals have been provided across the city. So to give a little context there, but to Dr. Santelises' point, it used to be a greater amount coming from schools on a regular daily basis. That's not practical anymore. So we are even seeing some declines in folks accessing certain locations even for food. So we're trying to figure out how to get food to where it's running out when another place seems to have a level of surplus. So those things are happening. And I also want to lift up that there are some other food access benefits like pandemic and EBT and other enhanced SNAP benefits that are getting activated now that could also speak to why there may be some decline in accessing in certain locations. But there's an ebb and flow to this that isn't always obvious as we track the data every day about where people are eating and where they're accessing food or not. So again, thank you for that question, because we know kids, no one's their best if they're not eating, let alone a child. So that's a very important question. Well, I want to say thank you for your time. I know you have a very busy rest of your evening communicating with the public, but if there's any last words you want to share.
And I think, one, I just want to say thank you. Thank you for, the delegation's continued, not just interest, but support of city schools, and it's actually helpful for us that we have this opportunity to contribute to the conversation, make sure your questions get answered, because a lot of you all get your own calls from the public. And so if you ever have any questions, anything you have for me or for staff, please reach out to Melissa Broom. She gets all the questions. She'll get them to either myself, the chief of staff, or the appropriate member of the leadership team. But I just want to thank you all for your support of city schools. This is the time where it shows, and it means a lot. So thank you.
Thank you. Thank you very much. At this time, we want to pivot to a member of our delegation, Delegate Maggie McIntosh. She also serves as chair of the House Appropriations Committee and is a member of the joint COVID-19 response task force, or work group rather, that has been sanctioned by the Maryland General Assembly. We want to take an opportunity for Chairman McIntosh to share a bit of the work that is happening with that work group in COVID-19, and also touch upon issues related to the future. As we all know, that the blueprint for Maryland's future, the education transformation bill that was vetoed by our governor, sometimes dubbed the Kerwin bill. I want to give her opportunity to share kind of next step there and to highlight some of the great work that's happening on the COVID-19 work group. Chairman McIntosh? I think we hear you. Yeah.
Thank you. Good to see you all. I kind of miss you all. Can you hear me? Okay. First of all, thank you very much, Delegate Smith, for keeping us together through this time. It's very important for us to be together, to share information, and to help our city and state agencies take care of the citizens of Maryland and the city. I want to touch on the COVID-19 work group, but I do want to follow up with the questions about transportation. Tomorrow, there will be at 2:00 a Transportation and Environment Subcommittee meeting of the Appropriations Committee, where we are in fact sitting down with the MTA and the Maryland Transit Authority to say, okay, you got a lot of CARES money, they got a lot of federal money. How are they using it? Some of it's supposed to be used for WMATA, but the very questions you ask about transit in Baltimore, our MTA system, and how are they going to help transport our students to schools are the kinds of questions we're going to be answering. So for those of you who are interested, actually Delegate Bridges is a part of that subcommittee. He will be on the call. I will be on the Zoom meeting. So, but we will share any information we get with you. COVID-19, that's a group of senators that was put by the Speaker and the President of the Senate to help, I guess, help with this pandemic in that we wanted to make sure that there was some accountability with state agencies, with the governor, and to help roll out to the public information they needed. I'm going to start by saying that something that, and I don't want to sound like a broken record, but I have said for years, 2 years now, our brothers and sisters in labor have been saying for 3 to 4 years now that our state agencies were being thinned out, that workers were not being protected adequately from normal circumstances in their jobs. And what has played out in this pandemic is that agencies absolutely couldn't handle what came to face them. DSS, Delegate Branch, has raised the whole issue of food and SNAP, Delegate Smith as well. The fact that applications came in and up to 2,000 workers at DSS they had to purchase computers so that could even facilitate getting those applications in for approval. So that has kind of finally happened. We hope they're catching up, but it was an incredible period of time where our state workers didn't have access to the internet or to a device to do their job, and therefore people weren't getting food. Two, you all know, you've read the Sun papers, you know better than I, or as well as I, that all of our constituent calls, 90% of them are about unemployment insurance. That was a total breakdown. And actually, many of you have written commentary op-eds about the fact that agency is not fixed. And I do believe, again, it's getting fixed, but that was an agency completely overrun by the demand and had no ability to meet it. I'm going to tell you that Commerce, even though the secretary has made herself very available for a number of calls, one of the things that we found is that they too are lacking and slow getting money out to our small businesses. And so I will just tell you that the COVID group, 19 group, has done really move the bureaucracy and keep the governor in checked around the issues that are happening. Finally, I will tell you that one of the agencies that DLS said 3 years ago was so crippled by the fact that this governor was not filling vacancies was the health department. And that has shown. Fran Phillips. Some we will all get I think can you hear now? Okay, good. On the blueprint, I think just stay tuned. We're going to override that veto. We're going to override that veto. And by the way, you know that the school construction money was tied to that. We will have to make changes. The Ways and Means Committee, Appropriations Committee will have to make changes once we override it because of the timing, the dates, and so on and so forth. But and we might want to look at the Kerwin bill in terms of the digital divide more closely. That's something we didn't take into account. But these things are going to happen, to the best of my knowledge, they're not going to happen until we go back. So that's my report.
Thank you so much. I'm just just want to do a quick scan to see if I missed anything. There's a broader question from the public. Someone wanted to know more about, particularly through the work group, what's kind of the conversation around family support more broadly. I think that when we're talking about schools, we're talking about supporting families and of course access to more food, but and unemployment also. But are there any other discussions around family support outside of the scope of those topics that you can think to come to bear? If not, we can follow up.
Yeah, right now, unemployment insurance, food, digital divide, I think, and public safety.
Right.
We also have focused greatly on what has been just a tragic of events with state workers who work in our public health hospitals, and so on and so forth. And as we begin to re-enter and go back to quote the new normal, and by the way, I've got to say, I'm so supportive, and I know we all are, of the mayor and our county executives who have penned a great letter to the governor today saying, you want us to open up Maryland, this is what we need to open up. And all of it is around protecting Baltimore citizens, Baltimore workers, state workers. So I just think we're at a crossroads now where we're going to now shift to how do we open up again. And that
Right.
means more tests, more PPE, it means more follow-up, and it means figuring out those things like Delegate Haynes mentioned, how do we get everybody to schools and how do we get, and so that's the corner that they're turning now that all of us are going to be involved. If you have any concerns or questions you want to be asked at this meeting, we meet on Wednesday mornings, just get them to
Okay.
Delegates Smith or get them to me and we'll get them asked, okay?
Fantastic. And this is a perfect segue to our Deputy Commissioner at the Health Department, Jennifer Martin. So thank you so much, Chair, and see you later.
By the way, our health department is doing a good job. Local health departments are doing great jobs.
Yes.
They lack the support they need from the state, okay?
Right. Right. Thank you so much. So I'll, at this moment, pull up the presentation from our Deputy Commissioner Martin. Just a moment. Okay, I'm Deputy Commissioner. Happy to begin whenever you're ready, and just let me know when to change the slide.
Okay, wonderful. Thank you so much. Good evening, everyone. My name is Jennifer Martin. I'm one of the deputy commissioners here at the Baltimore City Health Department. Thank you for having me this evening to speak a little bit about COVID-19 here in Baltimore City, and specifically about our efforts around contact tracing. So we can go to the next slide.
Just a moment.
So I just have two slides that are snapshots of our COVID-19 dashboard. So you can go to coronavirus.baltimorecity.gov to see this information. This is our data as of yesterday, the 18th. Is there a lot of feedback? I feel like there's a lot of feedback. Oh, that's better, thank you. So as I was saying, this is a dashboard that we have on our website in Baltimore City. As of today, we are at just over 4,000 lab confirmed cases of COVID in the city, with just over 200 deaths. This dashboard is showing us the breakdown by demographics. So you can see that in the city, we are seeing around 54% of our cases are in women, and about 45% male. And that breakdown is similar between cases as well as in deaths. We see slightly higher deaths and cases in women over men. In looking at the breakdown by race, we know that African Americans and Blacks are disproportionately affected here in Baltimore City, with over half of our cases being in African Americans or Blacks, and 70% of our deaths. In looking at the ethnicity data, oh, sorry, can you go back? Ethnicity data, We are seeing about 14%, just over 14% of our cases are in the Hispanic or Latino community here in Baltimore. And then just looking at the age demographics really quickly, you can see that we have cases sort of across all age brackets. But our deaths are by and large in our older population, with well over 70% being in those over the age of 60. So we can move to the next slide. And the next slide is just a snapshot of our dashboard showing some of the testing information for where folks can go to get tested at one of our city community-based testing sites. So you can see in the city, and again, this data is as of Tuesday. There were have been over 26,000 tests performed on city residents, with close to 21,000 of those coming back negative. About 3,000 of those have been collected at our community-based sites. And you can see, and I know it has been well reported, that testing continues to be one of the main challenges that public health is facing with the pandemic. Testing access has increased slowly but surely over the last couple of months. If you look at the map on the right, it shows where testing has been occurring in various parts of the city. The gray indicates negative tests, whereas the yellow is an indication of where those positive test results have occurred. And we can move to the next. Okay. So I wanted to talk just for a few minutes about contact tracing because it's been widely talked about in the news, particularly the need to increase public health's ability to conduct contact tracing all across the country. So contact tracing is actually one of the fundamental tools that we have in public health to stop spread disease. So, you know, we do contact tracing routinely in public health. Many of you may remember last spring, we actually had a measles outbreak in the Baltimore metro area. And so as part of our measles response, we were reaching out to those families of children who had tested positive for measles, and we were identifying who that child may have been in contact with, who may have been exposed to measles, so that we could try to stop the spread of measles in the city. And the way that we did that was through vaccination. Because COVID-19 is a new and emerging disease, we don't have a vaccine yet. So the only way that we have to stop the spread of COVID within our communities is to identify individuals who are sick and who have been exposed to someone who is sick, and to get them to stay home and minimize their contact with others to limit the spread of disease. So this slide is just showing a diagram that sort of shows, you know, how contact tracing works. We want to identify the individual who is sick, and we want to help them stay home so that they limit the number of people who are exposed. We can go to the next slide. So again, just wanted to point out that what we're trying to do when we are reaching out to people and conducting our case investigation and contact tracing is that we are trying to get in touch with people who have been exposed so that we can reduce further spread of the illness. We really are working very hard to message out to the community that there's a lot of myths about contact tracing and about it. You know, government is looking for a way to track people and get their information, and you know, do inappropriate things. Contact tracing is not a way for us to track people illegally. Again, it's about finding people who've been exposed and getting them to stay home to minimize exposure within the community. You can go to the next slide. And so why does it matter? I mean, I've touched on this a little bit already. This is the only way that we can prevent the spread of illness and prevent COVID deaths. It's only by limiting transmission and stopping the spread of illness that we're going to be able to safely reopen here in Baltimore. We're looking at reopening as a very intentional process and a very careful process. We know that we need to wait for a vaccine to come before we have proper immunity throughout our community. And so we know that we will be doing contact tracing for at least the next year, perhaps a year and a half, while we wait for a vaccine to be ready. And so this is very important work, and we know we need a lot more resources than we currently have to get to be able to conduct all of the tracing that we're going to need to do. Right now, people have been home for over a month, and we know because they're primarily home, folks don't have very many contacts. But once a stay-at-home order is lifted and more people go back to work or go back to school and go back to other activities, that there will be more interactions. And that means that when there is transmission and we do our case investigations, that individuals will have had more people that they have potentially exposed. There will be more contacts who need to be identified. We can go to the next slide, please. So when we do our case investigation, I thought it would be helpful just to share a little bit about what is the information that we do collect from folks when we're reaching out to them and doing our case investigation. We do collect some demographic information. We also collect information about what are the symptoms that they are experiencing. We ask them when they first started to have those symptoms. We talk with them about where they may have been exposed. So for example, are they a healthcare worker? Do they work in, or are they a member of a congregate setting, etc. Then we ask them to tell us who their contacts are, who they have been interacting with, who may also have been exposed. We ask them about their underlying medical conditions. We ask them if they are currently at home, are they hospitalized? We ask them information about their occupation. Again, that's very important because we want to identify individuals who live or work in congregate settings, because those are high risk settings. And we can go to the next slide, please. And so when we contact somebody's contacts, what we tell them is we notify them that they have been exposed. And again, we ask them three of the same things that we're asking our lab confirmed cases. We ask them what their symptoms are. We ask them what their occupation is. And we identify whether or not they live or work in a high risk setting. And then we provide them with quarantine instructions, or the instructions to stay home as much as they can and limit their interactions in order to, again, prevent the spread of COVID. And we can go to the next. I think that's the end. Yes. So I'm happy to answer any questions. Thank you.
Thank you so much, Commissioner. I wanted to share some of the questions that we've been receiving. I know you shared some of the information about the racial demographics that were known about folks that, you know, have been infected and so forth. There was a question about why do we not always know that background? I mean, 15.7%, there was an unknown race. Could you elaborate on why that is the case?
Yeah, that's a great question. We've been getting that question a lot. So when an individual goes to be tested and a lab form is filled out, race is not a required a demographic field that needs to be filled out on that form. So depending on where someone goes to be tested, those forms may be pre-populated based off of what's already in an electronic medical record for an individual, or they may not, they may be handwritten in. And so not all of the demographic fields may be filled in on a lab requisition form. And it is that lab requisition form with the results that actually gets transmitted to the public health department. And so it takes some time. I know there have been some articles about how we're working in Maryland to better integrate our system that receives lab reports with the state electronic medical record system to help have a better demographic picture of all of the individuals who are being tested.
Thank you. Another question was, do we have a sense of what percentage of Baltimore City COVID-19 infections are happening in nursing homes?
So I'm not sure I can say exactly the percent just in nursing homes, but what I can say is that because we're looking at a number of congregate settings, so nursing homes, assisted living facilities, homeless shelters, other group settings, I can tell you that about 35% of the cases in Baltimore City are in a congregate setting, which would include nursing homes.
Thank you. Delegate Keith Haynes wanted to know what's the percentage of the city's population that has been tested?
So I believe based off of the data, most recent data for today, that it's approximately 3% of the city's population that's been tested.
Okay. And Delegate Tony Bridges wanted to know more about the health department is generating or will be working to create opportunities for contact trace the workforce for contact tracers.
Yes, I neglected to mention that in the presentation. So yes, we are looking to increase our capacity to do this work. Since the pandemic started, we have pulled staff from across the health department to augment our regular staff that do this work. But moving forward, we know that we will need additional people. Also, some of our health department staff will need to get back to their regular job of childhood immunizations and other really important public health work that we will need to start providing again. So we are looking to increase our capacity in a couple of different ways. We are working with many of the colleges and universities in Baltimore City, working with their schools of nursing and schools of public health to bring on students to help with some of that work. And they will work with us in many cases for academic credit and get some really great practical public health experience. But we are also looking to hire some staff, temporary staff in 6 to 9 month positions. And we have not posted our positions yet. I know I've gotten many questions in the last few days. We're hoping to have our positions posted, at least some of them posted in the next week or so. And we will be looking to recruit individuals from Baltimore City. We are looking to provide them with the training that they will need. We are going to be working to provide them with the technology that they will need, as well as the training in the database and giving them scripts and providing training so that they feel prepared to do this work. But yes, we are looking to hire approximately 200 individuals to help support our efforts over the next 6 to 9 months.
That's very helpful. We have 2 more questions for you because we have 2 more presenters, but we really thank you for your time. The first question is, can you speak to what the coordination between the City Health Department and Baltimore County looks like?
Sure. So we, we work really closely with Baltimore County and Anne Arundel County because we share borders with them. And of course, our borders are very fluid and folks move across them. So we work really closely with them on an ongoing basis and certainly during this COVID pandemic as well. Often folks may live in the city but work in the county, or live in the county but work in the city. And so there is a lot of coordination between us when we're doing these case investigations and contact tracing. So we do work very closely with our partners in Baltimore County.
No, that makes sense. And the last question for you, coming from Delegate Melissa Wells, it's actually maybe a couple of questions, but we're going to count the final question for you, is that in the beginning we heard a lot about flattening the curve as being kind of the mantra of the public health voice. And is that still the focus, or are we moving toward the contact tracing to minimize community outbreaks? Are these 2 distinct goals, or not?
Yeah, that's a really a great question. I actually think of them as sort of working very closely hand in hand. So, we still want to work to flatten the curve, even when our stay-at-home order is lifted. It's really important that people continue to engage in social distancing and wear face masks and wash their hands and go out of their way to interact in a smart way to reduce their risk of exposure. So we certainly still want to try to flatten the curve, as it were. But also, like, as we're moving into this next phase where we start to lift the stay-at-home order and people start to interact more, it will be really critical for us to be able to identify new cases as quickly as possible and reach out to those contacts and get folks to quarantine and stay in so that we can minimize any new outbreaks that might occur.
Thank you so much. We really appreciate this insight, and I think people got all the answers that they, at least to questions that were presented to us, both on Facebook and through the chat. So thank you very much. At this time, we're going to be welcoming Andrew Fulginiti. He's with the Maryland Department of Labor as a legislative officer to go through some of the resources as it pertains to unemployment and other economic resources. So at this time, while he prepares to come online, I'll be sharing his presentation. Just a moment. Andrew, feel free to begin and let me know when I need to move on to the next slide.
All right, great, thanks. Can everybody hear me? All right, great. So thank you, Delegate Smith and members of the city delegation. Really appreciate inviting the department to be a part of this town hall. It's great to be able to be here and answer a lot of the questions I know people have. I think Chairwoman McIntosh did a great job.
Let me see if we've lost Andrew here. Just a moment. Andrew, it looks like you're on mute maybe. Hello, Andrew? Andrew?
Can you hear me now?
I can hear you now. Fantastic.
All right, I apologize. My technology is tired at the end of the day too. Apparently, it keeps freezing up and kicking me out. So I'll just hopefully it'll keep me in here and I can stay on. But if not, I'll rejoin as quickly as I can.
I do not hear you. Maybe you're trying to return. I think I see you back, Andrew. I'm not hearing you. I see you in the participant list. Okay, Andrew, I think you're speaking.
Yep, I'm back now. I apologize again. I'm not sure what's going on here, but I was just gonna say I appreciate the comments from Chairwoman McIntosh. I think she gave a great insight into just truly the challenges obviously the department has been encountering given the crisis. This pandemic is not just a health crisis, but it's now a very serious economic crisis for a lot of Maryland families who are facing some of the toughest times they've ever experienced in their lives. And, the department has been tasked with being a resource to a lot of those individuals. And so I will just try and touch on some of the programs that we have available that we're working really hard, truly around the clock to provide to the many Marylanders that are in need of those services during this time. As you can move to the next slide at any time, but as most are aware, the federal government passed back in March the Federal CARES Act, which expanded unemployment insurance.
I think I heard Andrew rejoin. I apologize. Are you with us, Andrew? Andrew, are you back with us? I think I see you. All right, we may have to go to our next presentation and maybe have Andrew call back in if he's not able to join at this moment. Nikki Chalmers, are you still with us with the State Board of Elections?
Yes, this is Nikki Charlson with the State Board of Elections.
Charlson, excuse me. Let me, would it be okay if I maybe switch to your presentation, Ms. Charlson, as we work out? Okay, perfect. Just a moment. Just a second. Okay, Ms. Charlson, I would like to properly introduce you. You are joining us with the State Board of Elections to discuss some of the concerns that are, at front of center for Baltimore City as it relates to participating in the June 2nd election. So I want to give you your opportunity and just, again, let me know when to go to the next slide. You're on mute, Ms. Charlson.
Sorry. Thanks for the opportunity to address the delegation this evening, and I'm happy to share information about the upcoming election. We certainly recognize that this is a very important election for all voters, especially Baltimore City, and we have been working very hard to deliver this election, and I'm happy to share some of those efforts with you and answer your questions. So next slide, please. Thank you. So just wanted to provide some important dates that are coming up. The moving to a vote by mail election meant that we could move the voter registration deadline closer to Election Day. And so that deadline is now May 27th. May 29th is the deadline for voters who would prefer or need to vote in electronic ballot. So that is Friday the 29th. And then June 2nd is the traditional election day, although it will look and feel a little bit different than normal. So there are limited in-person voting opportunities on June 2nd. Those vote centers will be open from 7 a.m. to 8 p.m. There are 4 of them in Baltimore City. If a voter wants to return the vote by mail ballot, which is what we're encouraging voters to do, it's the safest way to vote, considering the health emergency that we're under. Those ballots need to be postmarked on or before June 2nd. So the postmark, it's not just putting it in the mailbox, it's important to get the postmark. There also will be ballot drop-off boxes around the city. Those will be open 24/7 until 8 p.m. on June 2nd. So if a voter prefers to put that ballot in the drop-off box, which is under the, ballots are collected several times a day by local election officials. Those boxes are open until 8 p.m. on June 2nd. Next slide, please. So just some general information. We have about 3.5 million voters that are eligible for this election, and so they will be getting ballots. As I mentioned, there are 4 vote centers in Baltimore City, all of which will be open June 2nd from 7 a.m. to 8 p.m. There are at least going to be, well, there are 5 set ballot drop-off locations. Those are open now through 8 p.m. on June 2nd. I believe the city's ballots, the city's ballot drop-off boxes were delivered either yesterday or today, so they should be there. We are also in the process of getting 10 more ballot drop-off containers. Those are custom made for us, so the manufacturer is moving very quickly to get us 10 more for the city, and with the hope that they'll be delivered next Friday, which I think is the 29th. The locations of those I don't yet have yet, but I'm happy to say that we were able to get 10 more, and we're working with the local board of elections to find locations for those additional 10 containers. Again, once they're there, they will be open until 8 p.m. on June 2nd. Each of the vote centers are laying them out and designing them in a way to comply with the current social distancing and safety guidelines. That means that our poll workers will have personal protective equipment. We ask voters to wear masks when they come to vote and to just be aware of the things that are now standard in our lives of staying 6 feet away from people, wash your hands frequently, avoid touching your eyes, nose, and mouth. So that will look and feel a little bit different at those vote centers. And we are continuing to encourage voters who can vote and return that mail-in ballot to do so. And we are also supporting the local boards with providing remote access to canvassing. Those ballots, obviously a vote by mail election includes a lot of ballots for the local election officials to count, and we're supporting them in that effort under these very unprecedented circumstances. Next slide, please. We are engaging in an extensive public education and stakeholder outreach campaign. It started off, sort of kicked into high gear at the end of last week and will continue vigorously through June 2nd. It includes TV, radio, digital ads. It has a component for grassroots and stakeholder engagement, as well as earned media. We are looking to also do some more expanding the grassroots, do some more community engagement for city voters. And so we're working that in quickly. Next slide, please. And these are some slides that show you the graphics. This is, I think, the slide, Delegate Smith, that I said maybe could play. I couldn't get it to play, but if you want to try. Oh, lucky you. So there's audio to go along with that, but that's the visual piece of it. And so those have started to air. If you'd like to go back to the slideshow. thank you for being able to do that. Okay, thank you. So again, some more images that we're using for this election. Key messages, obviously the date, that this is a vote by mail election, that voting by mail is a safe, easy, secure, and free way to vote, emphasizing the requirement that there be a postmark to be considered timely, and letting people know how to get a replacement ballot if they don't receive the one in the mail. So there's a couple key messages built into that, which if you had heard the audio, you would have heard them, but the way this is set up. So these are some images that are part of our campaign, and the next page too has some other images. So again, multimedia, digital, TV, radio, really trying to hit as many voters as possible with a diverse, targeted campaign. We have a diverse team that's helping us with people experienced with getting into communities and delivering messages, and we're looking to expand that and communicate with as many voters as possible. And I'm sure there are lots of questions, so I will, oh, thank you, you got the graphics moving. There you go. Thank you. So I am happy to answer any questions that you have, and appreciate again the opportunity to be here and to share what we're doing so far, and answer whatever questions you also have.
Thank you, Ms. Charlson. So I'll start with a question from Delegate Boyce. She wanted to know, given the fact that Baltimore's ballots are coming a bit late compared to other parts of the state, will there be extensions on registration and electronic ballots?
So as of now, the registration deadline is already extended until May 27th. For voters who are not registered to vote, we will be having same-day registration available on Election Day. So if a voter is not registered to vote by May 27th, the voter can go to one of the vote centers and register and vote that day. And so the request for absentee, we can issue replacement ballots up through 8 o'clock on Election Day. So the need to extend the absentee deadline becomes less important. We can facilitate getting a replacement ballot to voters as close to 8 o'clock as we can. That's logistically right. The voter needs to be able to return it. So sending a ballot at 7:50 probably isn't going to work. But we have extended the deadline as close as we can. And with same-day registration, we can serve those individuals who are not yet registered to vote.
From a question from the public is that, studies suggest that as many as 10% of ballots will be returned without a signature. What kind of protocols are in place, or how is the Board of Elections making sure they are followed? Maybe even in the marketing and some of the promotion stuff that you're talking about. How much is that?
Absolutely. Thank you. That's a great question. And it's something that we're hearing about since vote by mail is so new for so many of our voters. The signature is such an important part. We need to have that oath signed, and it is part of our messaging, the importance of signing the oath, which if you saw on the video, there was a little graphic showing that. We do have in place procedures for the local boards of elections to reach out to voters who returned their ballot without a signature. And let me just be clear, the signature is not to go on the ballot. The signature is to go on the oath. So, but the local boards have in place procedures that if they receive an envelope that doesn't have a signature, that they reach out to the voter, let the voter know, and facilitate getting a signed oath from that voter before the ballot's counted. I'm sorry, I can't hear you.
Yeah, I should help.
Okay, thanks. That's okay.
There was a question from Delegate Tony Bridges. I think you may have answered it in part about when it's the last day a person can request a ballot by mail be sent to them to ensure that it gets to them before the deadline.
Yeah, it's probably going to be maybe Wednesday or Thursday of next week, maybe Friday. The ballots are going to be mailed right from the local boards of elections, so they enter the mail stream very quickly. So it gives us a little bit more time, but by Saturday and Monday, there's not enough time to mail the ballots. At that point, we'll be delivering electronic ballots, which do require a printer. We do not allow voters to return voted ballots electronically. So the issue with delivering electronic ballots is needing to have a printer.
Now, I know I've seen on social media that there are parties that have already attempted to, fill out their ballots, and maybe upon hearing in the public square that they filled it out incorrectly. Could you speak to the fact that they can request another ballot if they maybe completed it incorrectly? Maybe they completed it in the wrong color, ink, for example.
Okay, great. Well, thanks for clarifying. So if it's the wrong color ink, that's fine. If the scanner can't read it, then they'll be copied onto a proper ballot. So those kind of errors, the voters shouldn't worry about. They'll get fixed during the canvassing process, and it won't cause that ballot to be rejected.
Can you speak to what the canvassing process looks like? I know that many people are more familiar with machine ballots, things being counted that way. What does it functionally look like to have these ballots counted? What does that mean?
So it's a manual process. We've taken our mature absentee voting process that we've been using for decades and scaled it up to be vote by mail. So the procedures are in place. They are done under public observation this time around with remote observation to keep everyone as safe as possible. Some of the offices are still closed. And it's people looking at the envelopes to make sure, one, that they're signed, and two, that they're timely, opening those envelopes, and then removing the ballot from the envelope to preserve the secrecy. Once they're removed, they are not married back up, so the voter's privacy is protected through the process. There's a review to make sure that the ballot can be scanned, right? If somebody spilled coffee on it, we know it's not going to be scanned, but we can copy it onto a ballot that can be. The question of the wrong color ink, that's the time. If it's pink and we don't think it'll be seen, then we'll copy it onto another ballot. And then they're batched up and sent through a scanner. Baltimore City has a high-speed scanner, which is not like what we're used to seeing, but it just counts a lot of ballots quickly. But they also have the same kind of scanners that we use at the polling places where they can use to feed them in manually. They've been using the high-speed scanner, but they also have the precinct-based ones, the ones that we're used to seeing there to count. The machine's the same, the software's the same, so voters can be confident that their ballots are being counted by the same system that they would normally be seeing. And then we do a retabulation of all the ballot images after the election to validate that the count is accurate.
Thank you. We have a question from the public as it relates to the ballot boxes themselves. I think you mentioned additional ballot boxes in Baltimore City. And what's the criteria that's used to establish where they are sited?
So that is within the authority of the local board of elections. We, as I said, are getting 10 more for them. I think the thought is the 4 that are there now are in 4 different councilmanic districts. The thought is maybe that those next 10 could be in the remaining 10 councilmanic districts. So ultimately there'd be 1 container in each councilmanic district. And so that's what we've been discussing. And the Baltimore City Local Board of Elections is working very hard to find those locations to put them.
Thank you. Another question, we did mention if someone had the incorrect color ink, right? What if someone has completed this ballot in pencil?
It's the same thing. If it can't read the pencil, which I think it can, but if it can't, then the local board will just create a ballot that can be scanned. So yeah, ink or pencil, please don't worry. It'll be fine, and it will be counted.
Thank you for sharing with us. These are real inquiries we've received. So if we could get the answers now, that's why we're doing this. Another question from the public. Can you confirm that Maryland is a non-match state for the signature on the ballot does not need to look exactly like the signature on file with the Board of Elections?
That's a great question. It's one of those questions we're getting a lot of since this is a new process for us. Under state law, there's no, let me say it again. So under state law, there's no authorization to reject a ballot because the signature doesn't match. So we are looking that there is a signature on the oath, and that's the check we're doing.
Thank you. I'm just double checking to make sure I haven't missed any other questions that were posed. Just a moment here. I don't see any more questions that are just for the Board of Elections at this time. So I just want to thank you for making yourself available on very short notice. As you know, Baltimoreans are very, very anxious about the future of our city, the future of our state and country. And this is one of the most consequential elections that we face. So we want to make sure that everyone is able to exercise their right to vote. So thank you for availing yourself of this opportunity to participate in our town hall. We appreciate it.
Of course, I'm happy to be here. Thank you.
I think at this time, Andrew, are you with us by phone? Maybe unmute. Andrew, are you with us? I was told that Andrew would be joining us by phone from the Maryland Labor Department, but it appears he may not be with us at this time. We are nearing the time that we had posted that we would close, but what we will be doing is sending everyone who is participating all of the presentations so that you can have them for your own reflection and reference. And also as you are explaining what's going on with your neighbors, friends, and people that are in your network, you can at least reference something that comes directly from an authorized body like the appropriate state agency and so forth. So are there any general questions that people may want to pose in the last few minutes here? And we'll try our very best to answer them. Let's see, it looks like our caller might be muted. Let me see if I can find him. Andrew, is that you?
I'm here. Can you guys hear me?
Oh, he is with us. I'm very excited. So at this point, I will pull up your presentation. Just a moment.
That's totally fine. I apologize for the technical difficulties.
Oh, please.
I'm happy.
We're all doing
to
our
go
best.
through these and stay a little bit longer if you need me to. So.
I appreciate that flexibility. I have your second slide up when you discuss the CARES Act UI expansion.
Sure, absolutely. So I'm not sure what you heard or didn't catch from when I first started, but this is a historic crisis that we're facing, and the department prior to this pandemic and economic crisis was at a time where we were seeing historic unemployment lows. So in that regard, we were staffed and equipped to handle those kind of numbers, and in a very short period of time. Due to the pandemic and health crisis, now we're seeing numbers that really no one has ever experienced before. And as a result, the federal government passed the CARES Act to try and expand unemployment insurance benefits to a lot of people, anticipating that the great need, given that businesses and the economy has essentially been shut down with the goal of flattening that curve. So 3 of the new programs that the federal government created and have asked states to administer, you'll see on that slide there. I think most people are likely familiar with what's available now. So we have the Pandemic Unemployment Assistance, which is the major program which expands unemployment insurance to a lot of individuals who previously were not eligible. So those self-employed individuals, gig economy workers, independent contractors, and people that for various reasons may not have been eligible under the previous system are now likely eligible to file their claim and get unemployment assistance. The other 2 programs are listed there. We have an extension of benefits for Maryland residents, so they can now receive a maximum of 39 weeks of unemployment insurance if deemed eligible. And then there's also the plus-up payment of $600 per week which is a federally funded program that goes on top of an individual claimant's unemployment insurance. So if they're deemed eligible for regular UI or the pandemic unemployment assistance, this $600 payment would automatically be included in their weekly benefit statements, and that is through the end of July is when that $600 payment stops. We can move through to the next slide. So to be able to administer these brand new programs, which no state had ever had any experience administering, we partnered with a vendor to create the Beacon One Stop application, which was designed with the intention of being able to allow the maximum amount of people to file a unemployment claim entirely online. So that included these brand new federal programs and the regular unemployment insurance that was previously available. Now, certainly we've seen, just given the sheer volume, we've been experiencing lots of difficulties, and I'm sure all the delegation members and the constituents are very well aware of these. We are working truly around the clock to be able to make fixes and updates to these systems, to address the needs of all of our customers and your constituents, because as I mentioned previously, this is just one of those historic times we've never seen or faced a challenge quite like this, and there's a lot of Marylanders in need of our services. So we are doing everything in our power to improve these services so we can get everyone served. On the next slide, you'll just see some of the updates we've been doing. We continue to increase our capacity in every aspect. It's we are constantly hiring new staff, having to train them. Not only in unemployment insurance is a kind of complicated, complex process, so we're training them as quickly as we can. Obviously, we've moved to a more virtual environment, so we're trying to streamline those processes so we can get more people into the department to assist our customers. We've partnered with some outside vendors to increase our call center capacities. It's it's still not enough, so we continue to expand those contracts and add more people as much as we can, as quickly as we can, to service people and get those benefits into the hands of the customers as quickly as we possibly can. And I'll just wrap up really quickly because I know we're going to want to get some questions. I would encourage everyone who have questions to please go to our main webpage. It's mdunemployment.com. We have we're constantly updating that with resources. There's a lot of folks with lots of questions. A majority of our customers have never been in this situation and needed our services before, and so they're unfamiliar with the process, so there's a lot of questions. So we've put together a lot of frequently asked question pages, some video tutorials, and have a lot of resources available on our webpage that they can hopefully help themselves assist and navigate themselves through this complicated process. And then on the last slide, you'll see we just have some contact information, available to individuals. We set up some designated email inboxes that our staff is tirelessly working to get responses out to those in need. So with that, I'll wrap up. I know there's going to be some questions. I'm happy to stay and answer those.
Thank you so much. Actually, let me bring that up because people may need to see that content again for some of the contact information. I wanted to highlight a couple of questions that I've seen coming in through the Facebook stream. Someone wanted to know what can someone do if they are attempting to apply for unemployment insurance, but they are there's a missing employer from your benefits.
Yep. So it sounds like they're missing an employer when they file. So they're going to need to speak with one of our claims processors. Our claims processors are the skilled individuals that have that UI background. They utilize several systems to be able to research and act, go through multiple databases to pull up information to resolve those kinds of situations. So they're obviously we are aware that it's difficult during this time to get in touch with our claims processors. We just have limited resources, and we're trying to address everyone's case as quickly as we can. But our claims processors and specialists in the unemployment insurance division would be able to assist an individual in that situation.
Delegate Regina Boyce is asking about the old system. There seems to be an issue with the old system transferring information, web carts, et cetera, to Beacon. Is the old system still available at all?
So, so yes, we are aware of some of the difficulties experienced with the launch of the new system. The old system is a 20-year-old legacy system, so it is still, it didn't completely go away. We still utilize that for certain functions of the process. The systems are communicating with each other, and there's a lot of issues that we run into, and it's kind of a product of just being asked to build the plane and fly it at the same time. We are working with our vendors to, anytime we see trends like the delegate mentioned, and things that multiple people are experiencing, we're getting that type of feedback. It's very helpful. We're getting that to our IT teams, to our vendors' IT teams, so we can fix them for everyone. I can say that one of those has been the weekly web certifications. We're aware of data transfers that have caused some issues with the large groups of claimants with those, and as the product communicating between the systems. And so we do, our IT team has been working diligently around the clock to create a fix, and I do believe claimants are going to receive some notice this week about that. We're going to have an automated fix that's going to allow them to hopefully address a lot of those concerns as it goes in relation to the weekly certification process.
Thank you. And the delegate thanks you as well for that answer. I do not have any other questions for you, Andrew, via the chat features on Facebook or within WebEx. Is there anything else you want to leave us with before we wrap up here?
No, I just thank you again for having me be here. We know, like I mentioned, a lot of people are just facing some really tough times, and I would just say we continue to be here. We don't take our responsibility to serve as many managers during this crisis lightly. We are truly, I assure you, working around the clock, and we will continue to do so. We know it's not enough, and until everyone's been served. So we'll remain here. The department will remain here, working diligently to service everyone in need during this crisis.
Thank you so much for that briefing. And I just want to remind everyone that's on the line that we will be giving, in summary, the presentations to all who are assembled, and then also answering any questions that maybe are coming in after that presenter has left. I see that we had a question for the health department, for example, that just came through after the deputy commissioner had to leave. So we want to make sure that we get those answers and we make that part of the follow-up to you guys. But I do want to give a little bit of an update as it pertains to online access to SNAP, sometimes referred to as food stamps. About a little over a month ago, both myself and Mayor Young reached out to the Department of Human Services about activating our access to the online SNAP pilot that we were already approved to participate in through the U.S. Department of Agriculture. And we were assured through a public statement from our governor, as well as the leadership with NDHS, that they were going to rapidly activate online access to grocery shopping for SNAP customers. As we all know, that those who are already SNAP eligible currently have enhanced SNAP benefits as a result of the CARES Act. But there's obviously, as Delegate McIntosh and Delegate Chalmers branch have been working on through the work group, there's still a challenge around getting newly eligible customers processed so that they can access SNAP at all. So we are, as they mentioned, paying close attention to the ramping up of the processing of people who are SNAP eligible, but also paying attention to the parallel track of making sure the IT backend is sufficient so that all eligible customers are able to utilize their benefits online the way that those who are able to use Instacart and other similar services are able to do, to again keep people safely within their homes to every practical extent possible. So I just wanted to give that update that it's looking at something that could be accomplished within the next few weeks, early June. So we're continuing to monitor the pace of that progress, but it seems like it's literally around the corner, and that's after 3 years of being eligible as a state. So I'm glad that we're moving in the right direction. I also want to just extend a hearty thank you to the staff from my office and other offices who have done a lot in the background to make this town hall possible, specifically to Crystal York, who serves as the director of the Baltimore City Delegation, my staff, Tanea Moore, my chief of staff, and to the legislative staff for Delegate Melissa Wells, Matt Kramer. They're invisible, but they are doing so many great things, and we're so thankful for all of their help and support. Again, I want to be respectful of time. I know we're a few minutes over, but thank you for taking time out of your evenings to participate and get some information that we hope is beneficial to you and to you as a concerned Baltimorean who wants to make sure your neighbors, family, and friends have all the best and accurate information possible. So thank you, thank you, thank you. And we hope to continue to do this as a normal form of engagement moving forward. Thank you, everyone.